Hi, how's everybody doing today? Hope everybody's doing well and staying pain free. Hi again, my name is Sam. This video is to basically update on my hip revision surgery. Right now is post 8 weeks of my hip revision surgery on my left hip this time. I just want to kind of come back and give everybody an update and see how everything is going. So just a quick little disclaimer, I'm not a doctor nor a medical professional. Everything that I talked about are basically purely my own experience and medical treatment and everything that I have been used throughout my journey in this medical field. So if you have any questions or any concerns, please reference those to your doctors or pharmacists. They can give you the best advice. Thank you. So as I mentioned, as of yesterday is basically 8 weeks into my left hip revision surgery, and everything is going very well actually, a lot quicker than I anticipated. I believe I mentioned on my initial hip surgery video that everything's actually moving or healing faster than I anticipated. At least it's definitely healing much better than, or much quicker than my initial surgery 30 years ago. And you know, there's no doubt, there's with the wound vac and all that stuff, the surgical site, the incision basically almost healed within the week when the wound vac just came off. So a lot quicker. The only thing that I need to be concerned about is make sure I do not get the incision site wet, and at least for the first week, no showering. But thereafter, yeah, you can shower and definitely get the area dry very quickly. But again, do not shower, maybe not like once a day. Maybe shower like once in 2 days or once in 3 days, just to make sure wait for the healing to be completely healed before you get that wet, because you definitely do not want to get that infected. So yeah, the overall healing process is really coming along very well. I took some x-rays from my doctor. I had a post 3 weeks visit as well as a post 6 weeks visit from the doctor, and both time they took x-rays, everything is coming out very well. The surgery came out very good, and it's still in the of course recovery process. I have moved from a walker that I've been using for 3 weeks onto a pair of crutches for about 2 weeks, and then I went with one crutches for a week, and then right now I just got a cane, and I am out walking, just simply walking around my neighborhood. I have gone from what the doctors told me, do not do too much in the beginning with the hip, because they don't want me to straining the leg or to cause more damage, because I need to rest up the hip and rest up the body and let it heal. Yeah, so in the beginning basically they don't want me to sit for any more than an hour, or stand up or walk for any more than an hour, nor even lay down more than an hour. Of course that's during the daytime. At nighttime you gotta sleep, but yeah, it's to alternate between those, into moving a little more by the day, gradually add up a little more exercise, a little more movement. And up till today, or I should say up till yesterday, I was walking just with my cane for about half a mile within my neighbor. So it's not too bad. It's getting there, and but I still need to do a lot more. I started my first session of physical therapy, but again, it's been 8 weeks, or actually I could do that in the week 6, but that's the earliest appointment that they have. They don't have it sooner. So, but the doctor don't want to start physical therapy too early. That's because, you know, he doesn't want me to put too much work on the leg. But after a few weeks, yeah, the healing is going very well, and I just need to work the leg out a little bit more. So I'm heading in there right now. I don't know if I can get any videos inside. So yeah, this is my physical therapy place. So I don't know, again, I don't know if I can get any videos inside. I just got out of my PT's office today. As I mentioned, today is the first session, so I didn't know what to expect, but obviously there was a lot of paperwork that needs to be done, and there was quite a bit of assessment that the therapist needs to take. Basically need to figure out what was my, assess on my condition, and then he need to understand my medical condition before he can proceed, and then he assessed on the actual surgery to see how it went. Also take a bunch of range of motions that I have on both of my legs and hips, provided you need to measure the one that did not have surgery and then the one that had surgery, and see what the current range of motion is comparing to my other one. And the other thing that was quite important was he did a bunch of strength tests to see how much strength I have on the leg right now. Basically all the things I'm doing, the exercise and all that stuff, how much I'm doing, how much I'm using my leg at the moment, how much I'm walking. And I told him I actually just increased it to about half of a mile, which is quite a bit of an improvement for me, since, like I said, this is 8 weeks, and then I just started walking a little more than I anticipated. So things are moving in a good direction. And then he worked out, he gave me a few exercises that I should do at home. And then on the next session, he's going to see how well I do with these few exercises, and he told me to increase the walk a little bit more, and then assess again, and probably add on more weight to the exercise, or possibly a rubber band to increase the strength, of these exercises. So. Yeah, this is my first session. It's done today. So far in my recovery period, it's actually been doing well. Of course, it's only 8 weeks into it. My initial surgery, it took me probably 3.5 months before I get to this stage with the cane. So it's moving a lot quicker. I guess the most important process is to, listen to your doctor and follow their instructions on what you need to do. Every doctor is different. They probably give you some more exercise to do, or more or less, but they do want me to heal and get some rest. Make sure it's healed before getting too much on it. So yeah, a little bit of patience can go a long way. Anyway, that's all on my video. This is a much shorter video than anything. It's just a update on my recovery. And again, sorry about these loud noise outside. I don't have any of these fancy noise cancellation equipment and all that, but yeah. So yeah, that's all for my video. But as far as now, the process is basically waiting for a little bit longer, get myself moving more, and until my feet will feel like my own. I should be getting rid of my cane. Well, I actually can walk without my cane. I just want to make sure that I'm not going to fall. I don't want to take everything too quickly. And yes, that's actually one of the bullet points. Try not to do this too quickly. Thank you for watching. That's all for this video. So if you like my video, please give me a like and subscribe. I will have more of these videos coming out here and there. It will talk about my experience and hopefully share some of this journey with other people. If you have any questions or you have anything to share with me, please leave it in the message below. Love to hear from you. Thank you very much. Have a nice day. Bye bye.